All right, so my name is Fran, your friendly nurse, and I'm going to ask you what three words could I say to you right now that would change your life and how you think about every single choice you make? What could make you change your priorities in just a few short seconds? Just think about that for a minute. Here's another question. Have you ever lost anyone you love to a genetic disease? You, your family, your friend, or your patient could be next. What is a genetic disease? That would be an illness, disorder, or condition caused by abnormalities in a person's genome in that microscopic DNA, that double helix that we used to make when we were in science class. That means the problem is in your genes or genetic code. It may have been inherited and may or may not have been expressed in your siblings, parents, and grandparents. So, what are the five leading causes of death? Cancer remains a leading cause of death, second only to heart disease. Add to those two fatal giants stroke, diabetes, and Alzheimer's disease, and there you have them, the five top leading causes of disease in Americans today. The information we're going to talk about today is more centered on cancer, but it still applies to all the others because they share a lot of the same risk factors and they respond well to preventive management and treatment. So let's start with a little background. What can cause cancer? I beg you to listen. I made a mnemonic to help you remember those important causes of cancer with the three letters in the word beg. B is for behavior, E is for environment, and G is for genes. So let's get back to that life-changing question I asked you. What are the three scariest words your healthcare provider could say to you right now? You have cancer. You probably wouldn't hear anything else after hearing those three words. Unfortunately, that statement is probably true, whether it was in your past, present, or future. You've probably had it since you were in high school, around the ages of 15 to 17. We all have cancer cells in us throughout our lives. But how can this be true? Why aren't we sick all the time then? Well, we also have an amazing defense mechanism called our immune system that is constantly monitoring for cancer and trying to destroy it as soon as it's found. So then why does cancer cause problems? There are things that can affect the functioning of your immune system, like medication, disease, and stress. Many diseases can leave you immunocompromised, and you've probably heard about them in light of the current global pandemic with COVID-19, because they put you at higher risk of getting sick. These include conditions like diabetes, heart disease, respiratory disease, being older in age, and using medications like immunosuppressants and anti-inflammatories. Where can you get cancer? Unfortunately, there are over 100 types. You can have cancer anywhere from head to toe, in your brain, mouth, neck, lungs, pancreas, colon, ovaries, uterus, prostate, rectum, skin, cartilage, bones, lymph nodes, and even blood. Averages of lifetime incidence is very high in men, 1 in 2, and in women, 1 in 3. Just think about how many people that could affect in your family, friends, church, the place where you work, your patients. Genetics, what does it mean? It's the study of heredity or genes or those inherited characteristics, like whether you have blonde hair or blue eyes. Why does it matter? Your genetic code tells your cells what to express or become, cell by cell, before you're even born. You might be born with a predisposition to things like diabetes or anxiety or cancer. There are genetic tests that can be interpreted by a specialist in genetics to tell you whether you are likely to become to have one of those certain disorders. So genetic testing is much more widely available, and it can be done relatively inexpensively now at home with test kits. So they might ask you for a DNA sample where you just spit into a little test tube, and then you send it in the mail for the lab to analyze. So what if I mail in my sample and it says I'm at high risk for diabetes? Does that mean I'm destined to become a diabetic, dependent on insulin, waiting for an amputation? Well, maybe and maybe not. But if I can't change my genes, then my destiny is written in stone, right? Not necessarily. Genes are part of the recipe, but many other factors are involved. And that brings us to epigenetics. So that means on top of the genes. It's the other part that has to do with how that genetic information we just talked about is modified or influenced by our environment or lifestyle. You can think of epigenetics as turning on or off the switch in a gene to make something happen or to prevent something from happening. The good news is most of these are at least somewhat modifiable factors to include our behaviors, where we live, our choices about smoking, drinking, illicit drug use, diet, and exercise. So this is where we can really have an impact. Epigenetic clocks can also be used to measure our biological age using DNA methylation profiles or epigenetic markers that can help predict some of those common chronic diseases we were talking about. I looked at a lot of research, but Dr. David Servin Schreiber has an anti-cancer plan, which has just a few recommendations that really summarize all of that research and make it easier to remember. It includes managing stress, getting exercise, avoiding toxins, and eating healthy. So I came up with another little mnemonic to help you remember what to do to prevent cancer using the word STEM. S is for your stress management. T is for your toxin avoidance. E is for eating healthy. And M is for moving. So when does all of this come into play? As early as possible. Why? Because any disturbance during the development of germ cells in embryonic development, which can happen before a woman even knows that she's pregnant, has the potential to alter epigenetic programming. Teratogens are toxic to an embryo, and all of the major organs are formed by the end of the 8th week of pregnancy. Living a healthy life is especially important during these early childbearing years. Research shows that adverse nutritional, psychological, and social conditions, along with pollutants and substance abuse in early life, can cause epigenetic reprogramming and increase an infant's chance of having issues like behavioral problems, depression, anxiety, and they're also at a higher risk of addiction to illegal substances. Some research even shows that you can be affected by 2 generations back of things that your grandparents lived through. So what we do matters to us, our children, and even our grandchildren. Many people are diagnosed with cancer and left to wonder if they could have done anything to prevent it. It is difficult to know, but what the research shows is that making changes today, no matter how small, can help decrease the incidence and recurrence of cancer. If we start early enough, we may even prevent it in the first place. That's why I'm talking to you about this today. Many cancer patients are treated with surgery, chemotherapy, radiation, or a combination, but are not told to make any changes in their lifestyle. You can choose not to live around a power plant, use carcinogenic or cancer-causing chemicals, eat red meat frequently, consume high-fat, salt, or sugar foods. You can choose not to smoke, drink heavily for a long period of time, take illegal drugs, take medications with damaging side effects, and live a sedentary lifestyle. You can choose not to repress stress, get little sleep, keep damaging emotions to yourself, and live in a constant state of fight or flight, which activates your sympathetic nervous system chronically. Now let's get back to how to prevent this from the stem. Stress is good in some situations for a short period of time. Long term, it can cause lots of problems and decrease your immunity. This is why stress management is recommended to boost immunity with methods like yoga, meditation, mindfulness, and taking a holistic approach to health. Lack of healthcare coverage and low socioeconomic status also contributes to even higher risks of cancer and other chronic diseases and less opportunities for screening. So now we know that our genetic code and zip code are important to our health. Toxin avoidance is next. And we can make decisions to avoid things we know are toxic in our behaviors, like smoking, overeating unhealthy food, living a sedentary lifestyle, drinking excessively, and using illegal drugs. Eating healthy and moving are next. Obesity is a problem in this country, and it's rising at an alarming rate as stress, family, work, and financial issues leave us with the cheap and convenient options offered by fast food. The food industry has been using many chemicals on labels that they know are addictive and misleading for years. But there are also many superfoods that naturally help to boost our immune system to fight cancer and other diseases. They include broccoli, cabbage, cauliflower, onion, garlic, strawberries, blueberries, and raspberries. Ginger and turmeric are also anti-inflammatory. Eating a more plant-based diet is really helpful. Many of the chemotherapy treatments like tamoxifen are also plant-based, but it's much cheaper with no side effects if you eat them in food instead of take them with your chemotherapy. Exercise has also been shown to have a positive health finding in each of the 5 leading causes of death, including heart disease, cancer, stroke, diabetes, and Alzheimer's disease, along with countless other conditions. Now that we've made changes to prevent chronic disease, we have to monitor for it. Screening is also recommended by the U.S. Preventive Services Task Force for breast cancer, cervical cancer, and colorectal cancer, because if we catch it earlier, we have better rates of cure. In research, patients also cited a recommendation from their healthcare provider as the most important reason for having this testing done. So share the good news with your patients and your family. They can take control. In conclusion, I'm begging you to make healthy choices and teach others to do the same. What is the cause of those chronic diseases that can kill us? Remember that mnemonic: beg, behavior, environment, and genes. And then what is the simplest method to prevent those fatal diseases? Dr. Schreiber's anti-cancer plan summarized it best in easy terms with modification to 4 areas in your life that you can remember by using the mnemonic STEM. When there's a problem, we want to get to the root or the stem of that problem. STEM: stress, toxins, eat, and move. Stress needs to be managed and dealt with. Toxic environments and chemicals should be avoided. Eat a healthy plant-based diet and move your body in whatever activity you prefer to increase that exercise. Remember the causes of cancer with BEG, and then get to the stem of the problem and prevent or treat disease by changing the way you live. Thank you for your time.